Hi everyone, welcome to today's session. We are going to see question and answers from general surgery. So moving on to question number 1. Thyroid carcinoma is often associated with hypothyroidism, often produces hyperthyroidism, is usually euthyroid and occurs in nodules. The answer to this question is usually euthyroid. Moving on to the next question. A ranula is they've given 4 options: type of epulis, sublingual thyroid, thyroglossal cyst, cystic swelling in the floor of the mouth. The answer to this question is D, cystic swelling in the floor of the mouth. So what is this ranula? See, ranula is a form of a mucocele which occurs in the floor of the mouth in association with the duct of sublingual salivary gland. But sometimes what happens is this intraoral ranula, it may herniate through the mylohyoid muscle and it may appear as a swelling in the upper part of the neck also. But this type of a ranula is called as a plunging ranula. The treatment of ranula is excision of the sublingual salivary gland. So moving on to question number 3. In a case of parotid swelling, the diagnostic procedure of choice is, they've given 4 options: fine needle aspiration or superficial parotidectomy, nucleation and excision biopsy. The answer to this question is A, FNAC. So if you see, the open surgical biopsy of intrinsic neoplasms of the major salivary gland is actually contraindicated. The reason is it will cause spillage of tumor cells. So it's highly contraindicated. So they don't do a surgical biopsy. They go in for FNAC because it is a safe alternate when compared to that of a biopsy. Moving on to question number 4. This is a repetitive question. The parotid duct is known as, they've given 4 options: Wharton's duct, Stensen's duct, duct of Santorini, duct of Wirsing. The answer to this question is Stensen's duct. The option B, Stensen's duct. So moving on to question number 5. Erysipelas is caused by, they've given 4 microorganisms: Staphylococcus aureus, Staphylococcus albus, Streptococcus pyogenes and Haemophilus. The answer to this question is C, Streptococcus pyogenes. So if you see Streptococcus pyogenes, that is the group A beta hemolytic microorganisms, you can see it causes n number of diseases like erysipelas, cellulitis, necrotizing fasciitis, scarlet fever, rheumatic fever, tonsillitis, glomerulonephritis. All these are caused by Streptococcus pyogenes. If we see Streptococcus viridans, it causes endocarditis and septicemia. And anaerobic streptococci will cause liver abscess. So in this, erysipelas is caused by, the answer is C, Streptococcus pyogenes. So moving on to question number 6. Most commonly affected peripheral nerve in leprosy is, they've given 4: ulnar, radial, medial and lateral popliteal. So the answer to this question is A, ulnar. So if you see, we all know that leprosy is one of the most characteristic feature of leprosy is its effect on nerves. And if you see, the superficial nerves like ulnar and posterior auricular may be swollen and tender, and these are the most affected, and the most commonly affected peripheral nerve is the ulnar. So the answer to this question is A, ulnar. Moving on to question number 7. Moon's molars are seen in, they've given 4 options: syphilis, leprosy, amyloidosis, actinomycosis. The answer to this question is A. Syphilis. So we all know the stigmata of congenital syphilis is that Hutchinson's triad. So what are they? There are three things. One is the interstitial keratosis, the eighth nerve deafness, and of course the Hutchinson's teeth, that is the moon or the mulberry molar, and the peg-shaped incisors. So the answer to this question, moon's molar are seen as option A, syphilis. Moving on to question number 8. A patient with head injury should be carried in which position? They've given us 4 options: prone, supine, lateral, and sitting. So the answer to this question is C, lateral position. So if you see, a patient with head injury should always be carried in a semi-prone position and never on their back. The reason is this will prevent the accumulation of blood and secretion, and it will pull the tongue forward in a semi or a unconscious patient. So moving on to question number 9. Unilateral clefts are most common on, they're given 4 options: left side, right side, median, none of the above. The answer to this question is A, left side. So if you see, the incidence of cleft lip and palate is around 1 to 600 live births, and for isolated cleft palate it is around 1 in 1000. So the typical distribution of cleft types, if you see, cleft lip alone is around 15%, isolated cleft palate is around 40%, cleft lip along with the palate is around 45%. So moving on to question number 10. The term universal tumor refers to, they've given 4 options: adenoma, papilloma, fibroma, and lipoma. The answer to this question is option D, lipoma. So what is this lipoma or lipoma? So what is this? It is a slowly growing tumor which is composed of fat cells of adult type. They occur anywhere in the body where fat is found, and this is so called as universal tumor or the ubiquitous tumor. So in case if they are asking which is called as a ubiquitous tumor, even then it is lipoma.